Let's be real. Getting admitted to the hospital can be confusing, a little scary, and honestly, a bit of a black box. You're in a strange place, you're meeting a ton of new people, and everything is happening so fast. So today, we're going to pull back that curtain. We're going to demystify that whole admission process and show you exactly what's happening from the minute you walk in the door. It all kicks off with a conversation, but this is so much more than just filling out a form. Think of it like a detective story, and this is the first chapter. The healthcare team is basically gathering clues, piece by piece, to build a full, detailed picture of your health. Every single question, every answer, it's a critical piece of the puzzle. All right, so the admission process starts the second you're there. And the first goal is always to create a safe and comfortable space. But how you arrive, well, that completely changes those first few moments. Think about it, there are really two main ways this happens. On one hand, you've got a planned admission. This is usually way calmer. You might have even gone to a special clinic beforehand to get info and ask questions, which really helps with the anxiety. But on the other hand, you have an urgency, and that's a totally different ballgame. In that case, the number one priority is stabilizing you, period. They deal with any immediate threats first, before anything else. Okay, so once you're in a room, the focus shifts immediately to making you feel secure. The first thing a nurse will do is introduce themselves. That's how you start building trust. Then, they'll help get you settled in. And finally, they'll give you the grand tour of your new space. Showing you the call bell, where the bathroom is, explaining when food comes. It sounds basic, but it's so important for helping you feel like you have some control in a new place. So, with the immediate stuff taken care of, we get to the real heart of the admission, that first big conversation. This is where the team really starts to understand who you are and what's brought you here. But this isn't just some robotic checklist. This whole conversation is guided by some really deep, important principles. We're talking a holistic approach, which means they're looking at you as a whole person, not just a set of symptoms. It's patient-centered, meaning what you value and want actually matters. And of course, it's all wrapped in privacy, respect for your culture, and just good, clear communication. And it so often starts with this one simple, powerful question. They aren't trying to lead you to an answer. They're inviting you, they're giving you the floor to tell your story in your own words. This right here is the foundation of patient-centered care and where the real investigation begins. So after they've listened to your story, it's time for the hands-on part, the physical check. This is a very systematic, head-to-toe process. The goal is to get a baseline, a snapshot of your health right now, and to spot any physical clues they might need to know about. And a lot of times, this exam starts with the most vital stuff, right? Breathing and circulation. So a nurse will start by just looking at the chest, seeing how you're breathing, and then they'll grab the stethoscope to have a listen. Now, the official term for this is auscultation. It's just a fancy word, but it's an incredibly powerful technique. Just by listening, clinicians can find out so much, like if there's fluid in the lungs or if the heart has an unusual rhythm, all without doing anything invasive. It's pretty amazing. Now, what's really cool is that this listening isn't random at all. As you can see from these diagrams, there's a specific pattern they follow on both your chest and your back. This makes sure they listen to all the different parts of the lungs, checking for clear sounds and noting anything that sounds off. Okay, moving on down the body, we get to the abdomen. The assessment here is a three-parter. First, they look, then they listen with the stethoscope again, and finally, they use gentle touch, which has its own medical term, palpation. And to keep it systematic, they mentally divide the abdomen into 4 sections, or quadrants. The nurse will first look for any swelling, then listen in all 4 spots for bowel sounds. Those tell them if your digestive system is working as it should. And then finally, they'll gently press down to check for any pain or tenderness. From there, the check continues to your arms and legs. Here, they're really focused on circulation. Are your limbs warm? And also on your movement and what you can feel. A key part of this is always comparing one side to the other to see if there are any subtle differences. And here are 2 super quick but incredibly useful checks. One is the pedal pulse, feeling for the pulse in your foot. The other is capillary refill. That's when they gently press on your fingernail and watch how fast the color comes back. Both of these little tests give them an instant idea of how well your blood is flowing all the way to your fingers and toes. Okay, so we've had the big conversation and the full physical exam. The team has collected a ton of data. So what's next? Well, this is the most important part, putting all those pieces together to create the blueprint for your care. It starts by taking what you told them, your personal medical history, and weaving it together with what they just found during the physical check. They're starting to connect the dots. The next piece is absolutely 100% critical for your safety. They need to verify every single medication you take at home. Why? Because this helps prevent any bad drug interactions while you're in their care. It's a huge deal. And now for the final piece of this initial puzzle. And this one might actually surprise you. They're already thinking about you going home. Seriously, planning for a safe discharge doesn't start on your last day, it starts on day one. By understanding your home life, the team can plan ahead and make sure you have all the support you need for a smooth recovery back home. So that brings us to the big question. You have all this information, the patient's own story, the physical clues, their medications, their home life. What's the most important first step? It's all about one thing: prioritization. The whole point of this incredibly detailed assessment is to build a picture that's clear enough to decide what needs to happen right now. It's about creating that blueprint for safe, effective, and truly personal care from the very first hour.